The Conformis iUni G2 is a patient-specific unicompartmental knee resurfacing system. By utilizing proprietary technology and data from a patient's CT scan, implants are customized for each patient. The surgical technique for the iUni G2 resurfacing system is performed using patient-specific disposable instruments called iJigs. Step 1. Site preparation. Position the patient on an operating table with the leg resting on a foot support at around 90 degrees of flexion. Next, place the femoral iJig on the condyle and mark the anterior edge of the femoral iJig. Remove all cartilage beginning about 2 mm posterior to this mark, including the posterior condyle, using a 10 mm blade and a curved elevator or ring curette. Then perform a complete meniscectomy and scrape residual cartilage from the tibial plateau. Step 2. Balancing the knee. Select an appropriate balancer chip from 4 available sizes to achieve the desired ligament tensioning. Next, insert the selected balancer chip in flexion between the femur and tibia with the flat surface facing up. Then bring the knee into 0 to 15 degrees of flexion and confirm the desired tensioning. Step 3. Tibial cuts. With the leg in flexion, slide the tibial iJig onto the post on the front of the balancer chip and seat the tibial iJig flush against the anterior tibial surface. Drill and pin both holes on the tibial iJig and remove the tibial alignment rod if desired. Perform a sagittal tibial cut using the tibial iJig. The saw blade should be flat against the metal cut guide. The reciprocating saw blade can be left in to protect the ACL insertion while performing the axial cut. Then perform a horizontal tibial cut using the tibial iJig. Remove the tibial iJig followed by the resected bone segment. Step 4. Femoral preparation. Attach the L-guide to the bottom pinhole on the femoral iJig and place it on the condyle with the knee in approximately 90 degrees of flexion. Drill and pin the femoral iJig beginning with the proximal pin, using the blue disposable femoral pegs marked F. Remove the L-guide and spacer block in order to drill and insert the second pin. Begin the cut with the saw blade angled up slightly. Make a posterior femoral cut and remove the bone. Next, round the resulting anterior sharp corner from the femoral bone cut with a burr, rasp, or curette. Step 5. Tibial preparation. Place the tibial template and drill both holes to the stop sleeve. The tibial template should be flat against the vertical resection and follow the outline of the cortical rim. Next, using the orange disposable tibial peg marked T, pin the posterior hole only. Create a keel hole using the tibial keel punch preparation tool. Impact the keel punch by striking at the proximal end with a mallet. Step 6. Using a perforator drill bit, drill approximately 8 to 10 cement holes to enhance cement interdigitation on the femoral cortical surface. Place the metal implants into position. Next, apply a layer of cement to the tibia, filling holes and covering the bone surface. Then impact the tibial tray using the tibial impactor tip. Apply a layer of cement to the femur, filling holes and covering the bone surface. Impact the femoral implant using the femoral impactor tip. Insert the selected poly size, posterior end first, at an angle. Finish by snapping the poly into place, by pushing down on the anterior edge with the heel of the tibial impactor tip. Thank you for reviewing the iUni G2 surgical technique animation video. For further technical information or surgical training material, please contact a Conformis representative.